Good morning, everyone. Thank you so much for joining us this morning for our first Bear Update, monthly highlights from Nicholas Children's Hospital Foundation. If we have not met yet, my name is Michelle Boggs. I'm president of Nicholas Children's Hospital Foundation, and I've been with the hospital about 2 years. This is a special event. We are starting monthly for our Diamond Society supporters, and just wanted to take a moment to thank you so much for your support of our hospital. We would not be able to do all the great work we do every single day for our kids, patients, and families if it were not for your support. So thank you so much for joining us this morning. Today we have the pleasure of being joined by Dr. Chad Perlyn, and we're going to discuss children and COVID. And so I'm going to introduce Chad. He's going to talk a little bit about COVID and what we're seeing here at the hospital, and then we will do some Q&A. So Dr. Chad Perlyn joined Nicholas Children's Health System in 2009 and currently serves as our interim president of Nicholas Children's Pediatric Specialists, which is our physician-led group practice here at the hospital. He is also a practicing pediatric plastic and craniofacial surgeon. In addition, Dr. Chad Perlyn is an associate professor and chief of the Division of Plastic Surgery at FIU's Herbert Wertheim College of Medicine. As a pediatric plastic and reconstructive surgeon, Dr. Perlyn's practice is dedicated solely to caring for children and young adults with congenital or acquired anomalies and injuries. His clinical interests are in craniofacial surgery, vascular anomalies, and pigmented lesions of the skin. Dr. Perlyn is board certified in plastic surgery and has published numerous scientific papers and articles, lectured nationally and globally, and frequently provides commentary to media as a subject matter expert. As a Miami native, he enjoys being back in South Florida and working at Nicholas Children's Hospital, which he credits with saving his little brother's life in 1977. When he's not busy at the hospital, he is with his family or participating in interests like traveling, surfing, and gardening. Welcome, Dr. Perlyn.
That's quite the introduction, Michelle. Thank you. Thank you for everyone who got up at 7:30 this morning to join this call in the first of these series. I do want to take a minute and thank the Nicholas family, of course, their foundation, and all of you, the Diamond Society members and our foundation, for the incredible effort that was made during these COVID times. The foundation played really an absolutely fundamental role in our success as an organization in terms of getting through, particularly those first few months of the craziness of COVID. And that really was because of the generosity and support of many of you all in helping support the COVID fund. So thank you very much. Really a genuine thanks from me to you for those efforts. You helped us get gear that really protected our lives, and we're deeply grateful for that. So thank you. So this morning is the first of these sessions where we're hoping to have the opportunity for the membership to get to spend some time one-on-one or one on Zoom with our docs. And as Michelle said, my clinical interest is in pediatric plastic surgery. So you may think, why is a plastic surgeon talking to us this morning about COVID? Which is a perfectly legitimate question. But besides having the privilege to care for individual children, I have the privilege of being the interim president of our physician group. And so therefore I work extremely closely with our infectious disease doctors, with our ER doctors, the urgent care, the primary care, the ICU doctors, and really through my leadership role with that, have been a major part of the COVID team and have accumulated areas of expertise based on all of my colleagues that I hope to share with you this morning. So what do we know about COVID and what can we think? And I don't have any slides this morning. Really, this is supposed to be sort of just a conversation, a one-on-one type conversation. And I know we have some questions that we can go through at the end that many of you have submitted beforehand. Well, when COVID first started, we did not think it affected children, or at least not on a wide scale. And I do have a slide deck which I can share another time if people are interested. And it sort of watches this fascinating progression through the media of saying how COVID doesn't affect kids, not really a childhood illness. And then we start to see, well, maybe kids can get COVID. And then we start to see kids are getting COVID. And then we went through a phase about, well, kids can get it, but can they transmit it? We'll talk about that in a bit. And then we went through a phase which said, well, maybe kids can get COVID, but it doesn't appear to be as bad as in adults, but maybe they can get some sequela or after effects of COVID that we don't see in adults. So it really has been this sort of wild ride of information for all of us. And we as physicians have been keeping up with this, maybe just 1 or 2 steps ahead of the public, but it's been a rapidly evolving process. What I can tell you is that COVID does affect children. We know that. That's a fact. It does not affect children at the same degree that we see in adults. And most of the research shows from large national studies, and again, these numbers change, but as a generalization, if a child gets COVID, there's typically less than a 6% chance of having any major issue, less than a 1% chance of winding up in an ICU. So those are very favorable numbers for us who have children who are parents or grandparents, that the chance of our children getting COVID remains small. And if they do get it, the chance of them getting significantly ill remains exceptionally small. What we have seen in kids is the kids that tend to get really sick typically have other issues. So children who've had transplants, children who have had cancer or in the process of fighting cancer. And those things intuitively make sense. If the immune system is weaker, the chance of a child being more ill because of COVID is possible. The one other sort of major risk factor that we see is obesity. And so we do know that obesity is an issue. And for some of our teenage patients, that's been an issue. So we often don't think about obesity as a disease or as a comorbidity, particularly in the historical American population, but that is one issue that we've seen. But all in all, the good news is that I think people need to understand that COVID is possible for children to certainly acquire COVID. If they do, the chance of them becoming ill is very small. And if they do become ill, the chance of going to an ICU is even very smaller. And then the number of children who have perished throughout the country is profoundly, profoundly small. So again, favorable news for our children. I think one of the main questions that we get asked a lot is, can children pass COVID on? I think most folks now understand that kids can get COVID, but there's a lot of concern, perhaps by parents or grandparents, teachers. We've had a lot of questions from teachers about kids coming back to school soon. Can children pass COVID on to adults? And the largest study that was out on this suggested that for children over the age of 10 years old, they seem to be able to pass COVID on with the same frequency as adults do, as a fully mature adult. But children less than 10 seem to have a much lesser ability to pass it on, to transmit it. So again, that's really good news because although we're encouraging, and we can talk about school in a minute, children to wear masks and socially distancing, we get a lot of questions from our pre-K, VPK type kids. You know, how is my 2-year-old going to wear a mask? How are they going to socially distance? And although the schools have done an amazing job working with some of the things, you're right, it's hard to get a 2-year-old to wear a mask. But the chance of the 2-year-old transmitting COVID to someone who could get sick, an elderly person, is very, very small. So that is good news as well. Regarding schools, this is obviously a hot topic, and there's been a tremendous amount of work that's gone on by our amazing team here at Nicholas and lots of our physicians who have served on physician panels at different schools. I serve on 2 different panels at different schools, trying to develop the best means possible. all of these conversations are the same in that there's the recognition that we cannot eliminate any risk. And I think people have come to accept that. But when we feel comfortable that we can put the right social distancing practices in place at schools, which the schools have done a great job with, mask use, which we can talk about, I saw some of the questions, and you combine that with the risk of actually a child getting COVID, the risks become so small that the value of being back in school really trumps that. And the American Academy of Pediatrics has talked a lot about the importance of children being back in school as soon as a community felt that it was safe to do so. We've been watching the numbers very closely in South Florida. Those numbers have been falling. There's been a few blips, but overall the numbers have been falling substantially. And we are in a much, much different place today than we were in July. And that's because of the efforts of the community to begin to mask use and socially distance behaviors. So we'll have to watch how the rates change in the coming months. But for now, the majority of schools that are not open are planning on reopening with different staggered dates, but most seem to be throughout the month of October if we continue on the current forecast. The last thing that I'll say, and then we can get into the questions, which I think is the interesting part, because I know there's so much that you all want to hear, is the sequela of COVID in children. There is a multi-system syndrome, we refer to it as, where children can get rash, fever, some heart issues, and some other multi-system things. There was a lot of talk about that early on, and there was a lot of concern that perhaps children who are asymptomatic carriers maybe later could develop this. We've seen just a handful of these kids. We've built an amazing unit and are completely prepared to care for any child in this community who should develop any sequela of COVID. But again, the good news is that we don't see this overwhelming flood of patients. And although we're proud to have the resources and the infrastructure here at the hospital to care for them, fortunately, we've not needed to do that on a mass scale. So again, good news for the children of our community. With that, maybe we'll move into the questions, Michelle, unless there's anything else you wanted me to add or touch on.
No, I think that sounds great. So one of our first questions, Dr. Perlyn, what increased precautions are being taken at the hospital to ensure patient safety when we visit?
Sure. So that's a great question. And there is so much that goes on every day here to make sure that our patients, our families, and our staff is all kept safe. That's what we do every day as a hospital. And that focus of patient safety has always been paramount to us as an institution. But obviously, there's just a new set of things that we now put into the mix because of COVID. So when families arrive, or let's even go back before families arrive, you should receive a phone call talking about what to expect during the visit. One of the challenging things has been the number of patients coming into the hospital and who they come with. And this is something that we recognize. So our policy is a bit split, and I'll explain that. For children coming in for surgery or staying in the hospital, we want parents to be with the child. We want both parents to be able to be with the child, but we limit it to that. So we don't allow additional people to come in and visit the child. For children coming in for outpatient visits, for example, when they come to see me in the office, we do limit those to one parent. The exam rooms are small, and the purpose of that, again, is to really be able to follow social distancing recommendations. So one of the things that we've started doing, and we always enjoy doing it, is having one parent in the room with the child and the other parent on FaceTime. So you'll get a phone call beforehand about what to expect when you come to the hospital in terms of who to come. We try not to have extra siblings come. And again, that's because in the waiting rooms, we're trying to create social distancing for the welfare of everyone. When you actually walk on campus, the first thing you'll see are our greeters who are there with a smile and a thermometer, one of the digital thermometers, to take your temperature and make sure there's no fever. They'll also ask a series of questions about COVID exposure, family members, other things as such. And then they'll offer a mask to anyone who doesn't have a mask. We do ensure that all people, not just patients, that all people in the hospital are wearing masks. Mask use is fully embraced here at the hospital. And we also encourage people not to wear a mask with a valve. We can talk about this a little bit later, about why the masks with a little valve we prefer not to have people use. But so everyone does have a mask. Hand washing signs and reminders are placed all over the hospital. We've dramatically increased the number of hand washing stations and the alcohol stations. You'll see the waiting rooms are socially distanced with our Nicholas, the bear logo, bear paws placed certain feet to stay 6 feet away from the next set of bear paws. So we've really done a major effort to make the hospital absolutely as safe as possible. And we've had an outstanding process of that for our families.
Great. Okay, the next question. How do you differentiate between a cold, allergy, flu, and COVID, and when should you get tested?
So whoever asked that question who's listening this morning, if you can tell me that answer, you're going to win the Nobel Prize. Because that is probably the hottest question of the day. And it's a brilliant question, and it's the question that we all want to know, particularly as parents. And it's a hard question to answer. And my answer, for the most part, is going to be go get tested, which isn't always the answer that everyone wants to hear, but it's the safest answer for our community. So let's talk about the typical symptoms of COVID first. The classic symptoms were fever, high fever, and cough. Those were the two classic symptoms when COVID first came out that we were really looking for. But what we've learned is there are a lot of other symptoms of COVID that present very differently. One of them is abdominal pain, particularly in children. So that has nothing to do with cough, but we've seen children present with abdominal pain who have been COVID positive. Headache have been COVID positive. And of course, the loss of taste or smell. So obviously, I would say if a child was complaining of fever or cough, they need to consult a physician. Many of the pediatricians will do virtual calls. The urgent cares are fully available, as is the emergency department, of course. But high fever and high cough absolutely mandates a COVID test. In anything else, you really got to just talk to your physician who knows the child's history well and hear the symptoms, the degree of symptoms, any exposure, any family members who were positive, anything else, and really take it on an individual basis. But particularly for children in school, what I will tell you is that the school default, and all the schools are pretty in alignment or in tune with the same policy, that if you have symptoms out of the ordinary, you should get a test before going back to school. Because obviously the implications of such and the fact that the COVID symptoms can be masking are difficult. So most of the schools, if not all, are really very much advocating for that. The allergy issue is a bit of a trickier question because we do know that there are kids with chronic allergies, and we do know that there are toddlers with chronic runny noses. We've seen less of that with the children being socially distanced and not being in school. But time will tell as we come back into school what happens with that. There are some things on exam that a pediatrician can pick up that may be able to help differentiate between COVID and another respiratory illness, but it's tricky. And one of the tests that we have here at Children's and that we're proud to have is called the RPP. And that's a neat test because what it does is it not just tells you if you have COVID or not, which is what everyone wants to know these days, but interestingly, it also tells you if your child has something else. So it'll say, nope, this runny nose and cough is not from COVID, but it's from virus X, Y, or Z, which is just a regular run-of-the-mill community virus. And one of our concerns as healthcare providers, not just at Nicholas, but across the country, is as we come into fall, which is typically flu season, and as we go back into schools, will we see more and more of this pattern where we have kids with upper respiratory illnesses and trying to decide if they're COVID or not. So there'll be a lot of work to come on this, and a lot more tests are coming out to try to help get definitive answers to that question. I will say one thing, and that's about the flu vaccine. We are highly, highly recommending that children get their flu vaccine, and talk to your pediatrician about that, because that is one, you do not want to miss that opportunity and catch the flu, and obviously be in that quandary where you're trying to figure out if it's COVID or the flu. So we are very much recommending the flu vaccines.
Great. Okay. How do you feel about group sports now that students are going back to school?
So again, my answering some of these questions take with a grain of salt that it's my collective experience from talking with all of my colleagues and with the schools, and my own personal feeling as a parent. I'm not speaking on behalf of the school boards or anything like that. I think when the sports are done in an appropriate social distance and modified way, they're fine. So would I encourage wrestling at this point? No, right? Do I think swimming is okay, where the kids are staggered when they go out to the pool and they're in their lane? Yes. Do I think track is okay? Yes. You know, the football with the contact sports, again, could there be a big pile of 10 kids all on top of each other at once? Sure. Is there some risk in that? Yes. I think the risk is low because the interaction is brief. But outdoor sports with appropriate social distancing, I think are okay. And I think they're an important part of our children. Again, as we balance what our children need for their global health and well-being, we all need the ability to let off some steam and get outside and exercise. And so that's important. And I think the majority of schools have done a very good job in terms of planning for that. Schedules will be adjusted. One thing to think about, I know a lot of the schools, particularly some of the private schools, have leagues where the kids would travel long distances in a bus to go play a game up in, you know, Palm Beach. I've seen less and less of that, shorter time in buses, more buses so the kids are spread out. And again, with appropriate social distancing, it's okay. I'm going to let our kids go back to sports. So that's my personal preference with that.
That's great. Dr. Perlyn, what's the best type of mask for children who are going back to school for in-person learning?
Sure. So we get asked a lot of questions about masks. And you could find a dozen scientific papers arguing a dozen different things about mask use. I think the most standard answer is the 3-ply mask. The 3-ply surgical mask is what's standardly used around the hospital. It's the mask that we issue, and everyone's familiar with that. It's typically a blue or a white mask with the ear loops. So if we set that as the standard, as the middle ground, that's the mask that I've actually personally worn most of the time. I've had an N95, this sort of, you all remember early on in the pandemic, this coveted N95, which was amazing and necessary for us as physicians early on. But most of the time, I'm walking around with just a regular surgical 3-ply mask, just a regular medical mask. So if we set that as the standard, the 3-ply mask, and then we go up from that, the next most quote unquote protective mask would be a KN95. KN95s are pretty easy to get these days from the internet. That's a mask that has a bit more protection. It's a bit thicker than a surgical mask. It's probably going to be very hard for a young child to wear because it is a bit heavier to breathe through. Some of the high schoolers do use those masks, and I know that some of the private schools have issued those masks to their kids, so a KN95. None of us recommend the use of a N95 mask for a routine mask use. It is very difficult to wear, it is uncomfortable to wear, and really it affords a level of protection that for the average individual in contact, not in direct close proximity, doing procedures on a COVID positive patient really doesn't need from what the research tends to be. So again, back to that surgical mask. Now, cloth masks come up a lot. We tend to like the disposable masks better than the cloth masks, only because the hygiene of such. So in an ideal world, if someone had multiple cloth masks and they were washed after each use with soap and water and properly cared for, they're okay. But there's a lot of concern in the community with some of the cloth masks that they're worn, taken home, put on the kitchen counter, and then the next day the mask is touched and handled and put back on. So the nice thing about the disposable mask is that they're exactly that, they're disposable. But we do recognize that many of the families and the children like the cloth masks. They tend to be comfortable. So again, a thicker cloth mask, a more applied cloth mask, I think is better than something like a thin, like a buff or a gaiter. Most of the schools, again, is setting a gauge for expectations. Most of the schools are not permitting gaiters as a substitute for a face covering. They want a proper mask, and I agree with that. The last thing I'll go back to, we mentioned it briefly, was the notion of the valve mask. So this is really important to understand because people tend to think that that's a better mask. It looks a bit fancier, it looks a bit more medical grade, and it's a bit easier to breathe through. But let's talk about that for a second. So when we think about filtered masks, right? Michelle mentioned that I like to surf. So I'll talk about the surfboard shaper, right? The guy with the grinder sanding the fiberglass. Those masks were originally made, the N95 masks, for healthcare and for industry, so that you could breathe in and not breathe any fiberglass, but you could breathe out easily and let your breath come out. The problem is, if we're all wearing masks to protect each other, and one of those masks has a valve, and now we want to make sure that when you're exhaling, your exhalation is either filtered through an N95 or through a regular mask, the exhalation is dispersed down and out through the sides of the mask and not out through a blowhole, like a dolphin, if you will, right at the other person you're looking at. So the CDC has really issued several statements about these valve masks, and we take it fairly seriously as well. So I would not encourage the use of valve masks because you are protecting yourself, but you're not protecting those around you.
I had no idea. Now when I'm next to someone with a valve mask, I'm gonna move away.
Yep.
Okay. Kind of along the same lines of the masks, when a child gets picked up in the carpool lane, how do you recommend they take off their mask and sanitize in the car? And in addition, do shoes need to be sanitized on a daily basis?
So, carpool is a very interesting question as well. A lot of discussion about carpool. I think that carpools need to basically sign a pledge, right? It can be verbal, it doesn't have to be on a paper, but all pods of people have to be in agreement as to the collective behavior of who's going to be in your pod. And that word has really caught on, the notion of pod, whether it's the pod of classmates you're in or the pod of your carpool. You don't want to be carpooling with another family and then that family decides to have a socially undistanced party where they have 12 people over to the house, because that puts you and your child at risk. So we have spent a lot of time in the work with the schools talking about the notion of the pod and that. So I think that's just an important concept to have and to think about if you haven't had it, for those families to carpool. We do recommend that the children wear their masks in the carpool if you are with other kids from other families, because it's really no different than being in the classroom with the kids. If we encourage mask use in the classroom, it should be used in the car as well. You're with another set of folks, and again, although it's in your pod, if we're wearing masks in the classroom, which is even more socially distanced than the car, we should be wearing them in the car as well. So ideally, you would put your mask on when you got in the car, picked up the other kids, and they would get out of the car continuing to wear the masks. So I don't, I'm not sure exactly what the question was about what transferring the mask on and off when getting out of the car, but my answer would be that the mask should go on when you get in the car and just stay on. Should shoes be cleaned every day? There was a report early on about shoes being able to transmit the virus. There's been a lot of different reports about the virus's ability to live on surfaces. Mm-hmm. I'm not sure I would be obsessive compulsive about sanitizing shoes every day. But I know in my house, for example, and many of my colleagues, we've started a no shoes in the house policy. So we just leave our shoes outside. But I don't think there's great data on that one way or another. There's a bit conflicting data. As I said, there's reports that it was on shoes of healthcare workers, but there's also varying reports, and you all have seen much of it in the lay press about whether it can live on surfaces, doesn't live on surfaces, and there's still a lot of conflicting data. So in the air of caution, I would say yes. On the same token, we just have a no shoes in the house policy.
Great. What advice do you have for parents with kids who won't keep their masks on?
So practice, particularly for those kids who are not yet back in school. We are highly encouraging families to practice. Spend time wearing the mask together in your house. Say, let's make it mask hour, where mom or dad puts on the mask and the child. And this is particularly for the littler ones. And again, different schools have different cutoffs where they set for mask use, because we recognize that the little ones simply can't do it. It's just too difficult for them. But it is remarkable how we see, as physicians, the patients come to our office. We see little kids with masks on all the time, and most of them do well. So it is definitely doable, but we recognize that there are some kids who can't. One potential solution for a child who just absolutely cannot or will not wear a mask. Speaking of children, we saw one sneak past you there, Michelle. Is a face shield. And face shields are not a complete substitute for masks, but they do afford a level of protection if mask use was just not possible. So that is something to consider. But my real answer to that, as I said before, is practice, and use this time now to be practicing and getting your child used to having a mask on.
Great. Okay, I think we have one last question. How do you feel about sanitizing versus hand washing, especially in a school setting?
So that's a great question as well. My answer is hand washing. So hand washing, old school is the best school, right? And hand washing works really well because this virus is killed easily with soap and water. Regular hand washing will kill it. And there's a mechanical effect to hand washing. So we always like hand washing. Hand washing has to be done, though, properly. It has to be done thoroughly and for an extended period of time. So just a quick rinse without really washing your hands and getting all your fingers and scrubbing them. But hand washing does take preference to sanitizing. That said, sanitizing is totally an appropriate alternative when hand washing isn't always immediately available, and maybe kids are coming in off the playground or other things, and there's hand sanitizer, and hand sanitizer is a great second to hand washing. But when you can hand wash, we prefer it. Otherwise, sanitize away. And let me just follow up, Michelle. In one of the school forums that I did like this with the parents, someone asked the question, and it's funny, my wife likes to tease me about this as well, because prior to COVID, I used to always tease my wife that we sanitize too much, right? That kids should be dirty, right? Let your kids get germs. There's a lot of studies actually showing that kids who get exposed to stuff early on may have less stuff later. And we can talk about that down the road. But there's been some concern that using too much hand sanitizer is going to make our immune systems weak people have sort of picked up on what I was saying before, and thought, well, maybe if we use too much hand sanitizer, we're not going to get exposed to other bacteria, and we shouldn't use too much hand sanitizer. That's a myth. No one is going to have a weakened immune system for using hand sanitizer during this period of COVID. So do not hesitate to use hand sanitizer because you think it may lessen your exposure to other good bacteria or things like that. Please use hand sanitizer.
And I think to your idea of practicing wearing the masks as a family, maybe a refresher on hand washing would be good, especially with the little ones, because I notice mine are becoming less diligent as they were, in the beginning. So. Yep.
And go to YouTube. There's lots of videos that are out there that you can watch with your kids as to how to properly do hand washing. And there's fun videos that teach you to sing songs so your child can sing happy birthday as a sense of a timer, things like that. So go to YouTube and find hand washing for kids, and you'll find lots of stuff.
Great. Well, this was wonderful, super informative. Dr. Perlyn, thank you so much. Thank you to everyone for joining us this morning. And as we mentioned, this is our first of our Bear updates. We will continue to do these monthly. So in October, we're going to talk about vision health and just protecting your kids with so much increased screen time. And then in December, we're going to cover sports health as many kids start to go back into sports. So wishing you all a great day. Thank you so much again, Dr. Perlyn, for joining us.
My pleasure.
And thank you all for your support of Nicholas Children's Hospital. Take care.
Thank you all so much. Thank you.